skin problems related to diabetes are still very common. About a third of people with diabetes have skin problems, especially dry skin. Fortunately, most of these problems are treatable before they become serious. The key is early detection. Why should skincare for people with diabetes? Patients with diabetes have extremely sensitive skin. Their skin is often dry, prone to damage, difficult to heal wounds and leaves scars. Skin that is too dry can cause itching, cracking, and infection. The cause of the problem is that the patient's skin loses its ability to retain moisture and has a reduced ability to heal itself. So, patients should have moisturizing methods to limit skin damage caused by cuts, scratches, animal bites, etc. to avoid infection and deep infection. Taking good care of your skin also helps you prevent future skin problems. Causes of dry skin and skin diseases for diabetics. Blood sugar levels rise, causing the body to use a large amount of water to neutralize the sugar and excrete less sugar in the urine. Then the skin will become dehydrated and become dry. Plus, over time, diabetes damages blood vessels and damages nerves in the body. If the autonomic nervous system is damaged, the activity of the secretory glands will be disturbed. When sweating is reduced, it will aggravate dry skin in people with diabetes. Dry skin can appear on the hands, fingers, feet and some sensitive places such as armpits or hidden areas with a lot of rubbing. Dry skin is then prone to cracking, itching, flaking and is at a very high risk of infection if not treated promptly. Therefore, people with diabetes need to be more aware of the prevention, early detection and treatment of complications of dry skin. 10 tips to treat and care for dry skin in people with diabetes. Number 1. Control blood sugar. Controlling blood sugar is the most important step in curing diabetes. Maintaining stable blood sugar helps reduce neurological complications and peripheral arterial complications. It also helps blood flow to the extremities better, increasing the body's resistance and self-healing ability, thereby minimizing skin-related problems as much as possible. The reason is that an infection will cause blood sugar to rise, but high blood sugar will make the wound heal longer. As such, you should strive to achieve a healthy weight, control your eating more closely, reduce salt intake, maintain a healthy blood pressure, and exercise. Those are high requirements, but you should consult your doctor about increasing your oral dose or switching to insulin injections temporarily. Number 2. Control blood pressure. People with diabetes are often associated with an increased risk of high blood pressure. Norwood, Chief of Family Health Services at Henry Ford Hospital, West Bloomfield, Michigan, USA. The skin is the largest organ in the body, so it will be affected by everything else, causing adverse effects to your health. These measures will help lower blood pressure and blood sugar, increasing blood flow to the skin. As a result, the skin will be healthier and more resistant to pathogens. Number 3. Moisturize skin regularly. Moisturizing your skin is a must every day to achieve your long-term goal of combating dryness. The areas of the body that are most susceptible to dryness are legs, arms, back and abdomen. Dry skin is usually treated with a moisturizer. Some researchers suggest that oil-based creams are better than water-based creams at moisturizing the skin. Currently, on the market there are moisturizers specifically for diabetics. However, Stephanie Kovach, a clinical nutritionist and diabetes expert in the state of Columbia, USA, said that just using coconut oil is enough to moisturize. In case of itchy skin, tips such as applying a cold towel, applying fresh aloe vera, oats or a paste of baking soda with water can help you reduce this discomfort. Number 4. Moisturizing skin in cold and hot weather. During cold days, should pay special attention to moisturize skin. If you're indoors, use a moisturizer or humidifier regularly. A humidifier will help make sure the air in your home isn't too dry. If outdoors, wear gloves and socks to protect against cold winds. It is best to use waterproof gloves for better warmth. Similarly, the patient must also carefully moisturize in the summer. Use sunscreen every day and never walk barefoot. Even walking on the beach requires shoes or sandals. Number 5. Do not bathe with water that is too hot. Hot showers provide temporary comfort, but are not beneficial. For diabetics, hot water can dry out the skin, making it more prone to cracking. This inadvertently opens the door for bacteria to enter and cause an infection. Due to high blood sugar levels, the more favorable bacteria grow, the harder it is for the infection to heal. According to Dr. Norwood, diabetics should not bathe in hot water more than 48. Do not soak for more than 10 to 15 minutes. Some diabetics have peripheral nerve damage, numbness in the limbs, and poor heat sensitivity. Dermatologist Elaine Gilmore, University of Rochester, New York, USA advises patients to test the water with the forearm or another part that is still feeling. Alternatively, a thermometer can be purchased to check the water temperature before bathing. Number 6. Keep skin clean and dry. Besides moisturizing, some areas require staying dry. These are the areas of skin under the arms, under the chest area, between the legs and between the toes. Moist environment in these areas may become favorable conditions for fungal development itching. Therefore, the patient needs to make sure to dry these areas thoroughly after each bath. Patients can use a dryer to dry faster, but need to dry at a moderate temperature to avoid causing burns. Number 7. Choose neutral soap. For people with diabetes, do not choose soaps with strong detergents. These substances can cause dryness, irritation of the skin and do not have a moisturizing function. According to Dr. Norwood, patients should choose products that contain oatmeal. The ingredients in oatmeal have the ability to both cleanse, moisturize and soothe the skin after each use. Number 8. Drink a lot of water. Drinking plenty of water is the secret to healthier skin. The scientists also found that people who drank less than 8 glasses of water a day maintained more stable blood sugar than those who drank less than 2 glasses of water a day. The cause is thought to be because a lack of water in the body leads to increased vasopressin levels in the body. This hormone has the ability to stimulate the liver to produce more blood sugar. Number 9. Eat healthy food. Foods that are beneficial for people with diabetes are whole grains, low saturated fats, fresh fruits and vegetables. Limit eating too much starch, sweets, greasy foods or dried fruits. The composition of dried fruit also contains a lot of sugar, a group of substances that are harmful to patients. Number 10. Clean the wound with a suitable antiseptic solution. As soon as a wound on the skin is detected, especially on the foot, the patient needs to have appropriate treatment. If the wound is light, just wash it with physiological saline. Then, smear the wound with a suitable antiseptic solution to promote healing and avoid bacterial superinfection. As with diabetes in general, well-controlled blood sugar is the basis of treatment for diabetic dermatosis. The next goal is to restore or maintain disrupted skin barrier, chemical and immune barrier, including the skin's ability to bind water. If symptoms such as itching or a feeling of tension are absent, appropriate skincare should still be taken, as a precaution. Older patients, in particular, should be made aware of the importance of daily lotion, and not just on the face and hands. Therefore, you should have the most effective skincare method to protect your skin from the bad effects of diabetes.